Hi B, what's this Daridorexant?
Thank you for that question, Dr Browne. Daridorexant is an almost unpronounceable new treatment for insomnia. It stands out because it's the first treatment in its class to be approved in Europe, and it's also the first treatment to be approved by NICE for longer term use for chronic insomnia. But how we manage insomnia has changed dramatically in recent years, and it's really important we understand how all this fits together before we start to get to know Daridorexant. So I've divided this video into two parts. The first, I'll cover where this treatment fits alongside other treatments for insomnia, and the second, I'll look at the drug itself. Insomnia disorder was recently redefined as a condition in its own right, and not simply a consequence of other conditions like anxiety, pain, or depression. I feel this is a really helpful way of looking at insomnia, as we can now compare it to the management of a condition we're familiar with and work out where each treatment fits. So I'd like to compare insomnia to how we manage type 2 diabetes. When someone's first diagnosed with type 2 diabetes, step 1 is diet control. And if this doesn't work, step 2 is always metformin. And if that doesn't help, we look at other treatments from there. When we look at insomnia, NICE have a very clear definition for it, and this goes on to divide patients into two groups: acute insomnia, describing symptoms lasting up to 3 months, and chronic insomnia, describing symptoms on 3 nights or more per week for more than 3 months. Thankfully, step 1 for both groups is sleep hygiene, and if this doesn't work, step 2 should be a course of cognitive behavioural therapy for insomnia, or CBTi. Clinicians often aren't familiar with CBTi and how this differs from CBT, but it's basically a comprehensive course which aims to reshape a patient's thought patterns around sleep, interrupting the cycle of exhaustion and poor sleep suffered in insomnia. CBTi can be brilliantly effective for patients, but could never be delivered in a 10-minute consultation, so we need a separate service to deliver this. But unfortunately, the availability of CBTi was disappointingly limited until recently. If we go back to our comparison to diabetes, imagine if people in Newcastle were allowed to receive metformin, but people in Manchester couldn't and had to go straight to second-line options. This sounds ludicrous, but this is actually quite similar to the situation that the NHS was in with CBTi up until quite recently. This meant that unfortunately a lot of patients had to pay privately, and some of the clinics were extremely expensive, with certain courses costing over £1,400. Thankfully, the situation with CBTi is much better now, and most of the country will have access to this on some level. Familiarise yourself with the courses available in your area, but in our region we have access to a NICE approved app called Sleepio. This completely automated service will guide patients through a 6-week journey to help them with their sleep. To my knowledge, this is free for the patient and costs the NHS about £45 for the course. For patients who can't use apps or don't speak English, I've included a link for a free guide to CBTi, which is available in a few different languages too. This is very self-directed, but I do feel a lot of patients will engage pretty well with this. So if we reach the end of a CBTi course at step 2 and patients are still struggling with insomnia, this is where Daridorexant fits in. But this is where our comparison to diabetes has to end. Whereas the treatments from step 3 onwards for diabetes are all intended as long-term treatments, Daridorexant is intended only as a short-term course to induce remission of the insomnia. NICE advised that treatment with Daridorexant should be kept as short as possible and should be reviewed at 3 months. The data for use beyond 12 months is also quite limited from the trials, so whilst it's licensed for longer term use, we do need to have a plan for when we're going to have a trial without this before we even think about starting it. Join me in the next video where I'll go through Daridorexant in more detail. See you next time.